Hi everyone, I'm Dr. Bridget Matarazzo and I'm the clinical lead for the REACHVET program.
And I'm Dr. Nazi Barani, I'm the education lead for the REACHVET program.
And we're here today to talk to you all about how to talk to veterans about the REACHVET program. There's a lot of interest in understanding how these conversations might go. And so we're going to go through a few different scenarios today. We know that these conversations might vary depending on who the veteran is that you're serving, how much you've worked with them before, that sort of a thing.
First example we're going to go over, the veteran and provider have a really good rapport. The veteran is engaged consistently in treatment, and the provider knows a lot about the veteran. Because the veteran isn't scheduled to come in for another couple of weeks, the provider is going to outreach the veteran by phone.
Hi Dietrich, this is Amanda from the VA. How are you?
Hey, how are you?
Good, thanks. I was just calling to check in and tell you about a new program we have called REACHVET. Do you have a couple of minutes?
Yeah, sure. I'm good for a little while.
Okay. So REACHVET is a new program we have that helps us to identify veterans who may benefit from some additional treatment options and support. So based on certain factors found in your medical record, like your recent ER visit, you've been identified as someone who might benefit from this program. So that just means that moving forward, I'd like to check in with you more regularly and ensure you're getting the best care possible here at the VA. How does all of that sound?
Yeah, that sounds great. I think I'd like that.
Great. So based on my chart review, I know that we previously talked about some challenges you described with transitioning back to civilian life and some suicidal thoughts that have come up for you. What does that look like this past week?
Things have been going well. I did have some stuff a while back, but it's looking better.
Great. I'm glad to hear that it's looking better. Have you had any thoughts about harming yourself this past week?
No, I've been good. Little bumps, but nothing serious.
Okay, good. Well, let's plan to touch base about that again at your next appointment. And at that appointment, I'd also like to talk more about some care enhancement options that might provide more support for you. So let's plan to update your treatment plan, and I have some ideas about some groups you might be interested in. How does that sound?
Yeah, sure. What kind of groups do you have?
Well, we do have one transition group as well as a PTSD group, and we can talk more about the other group options that you might like.
Yeah, I think I would probably be interested in the PTSD group.
Okay, great. Let's plan to touch base about that then in a few weeks.
Okay, great.
Okay, I'll see you then. Thank you.
Sweet. Bye.
Great job, Amanda. So you did a number of things beautifully, and just for the audience, I'm going to highlight the important components just so that they know when they're outreaching their veterans. You did a really nice job of explaining the REACHVET program first and foremost. You then sort of explained to him how Dietrich was identified as part of the program by referring to factors in his medical chart. You also did a really nice job in summarizing sort of what that means. Basically that you'll be checking in with him more often and really opening up a discussion on ways that you can enhance his care. And because you did know him, you could really lead into some specific factors from his chart that lead to increased risk, and in particular the transition time, and actually ask him specifically about suicide risk. So those were all really great and important points that you covered.
Yeah, I agree. It was really, really well done. And the reality is that we know that a lot of veterans who are getting identified through the REACHVET program might not quite fit the bill for this scenario. So you may have veterans who they're getting identified because maybe they've just had a few ER or inpatient visits, but aren't really engaged in care otherwise. And those conversations might be a little bit more challenging to have. Some of those veterans might also not receive any outpatient care, so might be getting their care through primary care only. And so this next scenario that we're going to move to is with a primary care physician having this conversation with a veteran who is recently discharged from the hospital. So thanks for coming up. So Dr. Simonetti, we'll have you play the role of the primary care physician who's outreaching Georgia, who's a veteran who was recently hospitalized.
Hello.
Hi, can I speak with Mr. Art, please?
Speaking.
Hi, Mr. Art. This is Joe Simonetti. I'm not sure if you remember me. I was the physician you saw in clinic maybe about a year and a half ago now in the VA.
Yeah, I think I remember meeting you.
Yeah, how are you doing? Sorry to call you out of the blue like this. Is now a good time?
Yeah, that's fine.
Okay. One of the reasons I'm calling, I was just flipping through your chart and I noticed that you were just hospitalized, and we saw you also missed your follow-up appointment. And I wanted to touch base and see if you're doing okay, make sure you got your medications. Is everything going okay?
Yeah, I went down to the pharmacy and picked everything up.
Okay, good. And how have things been going since you got home?
I'm fine. Maybe some overwhelmed, but I'm fine. And things have been. I just couldn't get to my appointment. I had to
Yeah.
go to school, and I just haven't been able to get there.
Yeah, I totally understand. What do you mean by overwhelmed?
Just getting back to my daily routine after getting out of the hospital. Just
Yeah.
been a lot.
Yeah, I understand. Okay, well, the other reason I'm calling is it's actually about a program we have at the VA called REACHVET. I'm not sure if maybe you've heard about this in the news, or maybe anybody mentioned this to you while you were in the hospital. Have you heard of it?
No, it doesn't sound familiar.
Okay. So REACHVET is a program that helps us take a look at your chart and give us an idea. Maybe you might be going through a challenging time. And looking through what's been going on the past month, I noticed you were in the hospital and then you weren't able to make your follow-up appointment. And I just wanted to call and see, just generally, how are you doing? Is there anything we can do to support you, or is there anything I can do to support you?
I think I'm good. I don't feel like I need anything else right now.
Okay. I flipped through the chart when you were in the hospital. I also spoke with your psychiatrist, and she mentioned that you came in with some feelings of worsening depression. I know you had also had some thoughts about harming yourself at that time, and I just want to say I'm so sorry to hear about this. How has your mood been since you left the hospital?
It's been good. I feel like I've been stable. I haven't had any of those thoughts.
Okay. And by any of those thoughts, what do you mean by that?
I haven't been thinking of harming myself.
Okay. So not at all since you've left?
No.
Okay. Well, I'm glad to hear that. I'm glad you're starting to feel a little bit better.
Thank you.
Would it be an okay idea to come in and see me sometime, just to make sure that everything's going well and see what else we can do to help you out?
Would it be okay if I called and requested an appointment? I'm just not sure of my schedule right now.
Yeah, absolutely. I know it's sometimes difficult to schedule, and I'm sure things are pretty busy since you just got out of the hospital. But it would be great to touch base sometime soon so we can make sure we're doing all we can for you.
Okay, thank you so much.
Yeah, nice to talk to you.
Thanks.
Bye.
Bye.
Great job. Excellent. Wonderful way to sort of just represent how you don't have to have a really solid rapport with someone and still be really effective, and sort of outreach them and offer sort of additional enhanced care options. I think what you did really well, Joe, was really normalize sort of where she's at right now by just sort of building that rapport and engaging with her on her recent experience being hospitalized, and really noting how that can be a really difficult time. And then leading that into sort of an explanation of the REACHVET program and sort of how she was identified. Georgie didn't make it easy on him, but he was persistent and really did sort of do a really nice assessment of your current state and current risk. And although you there was no sort of plan specifically or scheduled date to return, you really did seem sort of engaged with him and open to that possibility.
Yeah, I think it was a lovely example of how this type of communication, even if you don't know each other that well, can really be perceived as a very caring sort of outreach from the VA. And that's a lot of what we're hearing from providers too, is that veterans are feeling just really grateful for the extra attention. So it was a nice example of that.
Actually, one thing I wanted to add about the previous scenario too is that we've gotten a lot of feedback from providers that work in teams.
Yes.
And in this case, we had that Joe, the primary care provider, actually outreach the veteran. But in other situations, and particularly those who use a team approach, it might be the nurse manager who actually reviews the chart and outreaches the veteran on the provider's behalf. So just kind of using what works in your system, and just wanted to sort of emphasize that that's an option too.
Yeah, thank you. I think with PAC teams and BHIP teams and a lot of team-based care happening in the VA, that's a great addition and a great model to use. But so to switch things up again, we know that there's some concerns from the field that veterans are going to have a lot of questions about this program. So in this example and the prior one with Dietrich, these veterans are pretty easygoing about the REACHVET program, not a lot of questions. And that might not always be the case. So in this next scenario, we're going to have it set up so that a psychologist has already outreached a veteran about REACHVET, and over the phone, the veteran started to have a lot of questions. So the psychologist decided, you know what, I'm seeing this patient in a few days from now, so let's just tackle those questions in person where we can kind of get into it a little bit more. So we're not going to do the whole kind of run through of REACHVET again, since you've heard that twice now, and we'll just pick it up in session where the psychologist is answering the veteran's questions about the program. rightfully so, veterans might have a lot of questions about this program and why they've been identified. So in this next scene, we're going to cover that. So we're going to pick it up as if Dr. Cannizzaro, a psychologist, has called Chad to let him know about the program and kind of follow the steps that she's supposed to. During that phone call, Chad had a lot of questions. So Dr. Cannizzaro said, you know what, we have an appointment within the next few days. I'm going to go ahead and just talk about this in person so I can make sure that I'm really addressing his questions. So we'll go ahead and pick it up there.
Hi Chad, welcome back.
Thank you. Nice to be here.
Yeah, I noticed our phone call, our last phone call, you had a number of questions about REACHVET that I was mentioning.
Yeah, it's been on my mind.
Yeah, I'm glad you asked those questions. They're really common ones. Would you mind if it's okay today just to talk a little bit about REACHVET and what that means?
Sure.
Great. So REACHVET is a new VA program that focuses on recovery, engagement, really collaboratively working towards your health care. So what does all that mean? It means that looking in your medical record, there's certain factors. For instance, we talked about, a long time ago you had a suicide attempt,
8 years ago.
8 years ago. Very long time ago. You've come a long way since then.
Mm-hmm.
We've worked together for a good amount of time now, and I guess it's just an opportunity to kind of check in to say, how do you think this treatment's going? Are we covering the things that you really wanted to cover in therapy?
Treatment's been helpful. I'm not as depressed as I was when I started. And I haven't had any suicidal thoughts this week.
Excellent.
I am still kind of wondering, though, about how I got selected for this, what is it, REACHVET? Something
Mhm.
like that?
Mhm.
This REACHVET program?
Yeah.
How I got selected for it.
Yeah, that's a great question. So specifically, REACHVET, it looks at different factors in your medical record, and those things can be something like chronic pain, it can be certain medications folks are on, it can be a previous suicide attempt. These things are taken into consideration to tell me as your provider to say, hey, are we doing everything we need to make sure that you have the tools to be successful? Does that make sense? Excellent.
But you were talking, I was selected for this program because you had gone through my medical chart and that I could be a suicide risk, but I haven't had a suicide attempt in 8 years, so I still don't understand why I'm selected for this program, because you said it's for people who are at risk, and I don't see myself as being at risk. I don't understand.
Yeah, it's a good question. I'm going to look to Bridget really quick to kind of help us. Bridget?
Sure. So I might say something along the lines of, you're absolutely right. And what you're talking about is really kind of how you're doing right now. And part of what REACHVET helps us do is look at some risk factors for how you might do kind of looking forward. And you might do just fine. But we know that veterans who are being identified through REACHVET are just at risk for things happening. Doesn't mean they're going to happen. There's some folks that are getting identified that are doing really hard work like you are, that's going to make it so that those outcomes like suicide, other hospitalizations don't happen. And so the work that we've been doing together is really great. But I want to make sure that you have everything that you need to prevent those things.
So I guess what I'm wondering is, given how I'm doing, how can I get out of being in this program?
Yeah, that's a good question. So REACHVET is not a typical program in the sense that, you have to do certain things. It's really more to just encourage me and you to chat like we're doing now about.
Oh, it's not a program?
It is a program, but it's.
But it's not a program.
It's not a treatment program.
It's not a treatment program, okay.
So it's not a treatment program like you would typically see, like substance abuse treatment.
Yeah,
This is really just an opportunity to check in about how you're doing today, to see if there's things that we could include in your treatment that would help you to be more successful in recovery.
Okay.
Does that make sense?
Yeah.
Okay.
Yeah, it does.
So in looking and reviewing your chart, I've noticed again, as you said, depression has gone down, suicidal thinking has been absent for some time. Are there other things that perhaps that you've heard about at the VA, or other things even outside of the VA that you would be interested in doing, or things that you think would help to sustain that progress?
Well, I think I have everything I need. I don't really like coming to the VA. It's been helpful to me, but I don't see that I need to be doing more here. I think I have everything I need.
Okay, perfect. It's really great for me to hear, that feedback and that the treatment that we're doing is really effective. Again, in that chart review, I noticed the safety plan that we had created a while back.
Oh yeah, that safety plan.
Yeah, safety plan.
Yeah.
And again, it's not something that necessarily we might need tomorrow, but it could be something we could just review together to see, all right, are we still covering our bases? Do you still have, for instance, you mentioned you really like listening to music when you have kind of a bad day or kind of get in a funk. So could it be something we talked about today just to see if we need to update anything?
Yeah, I actually haven't looked at that safety plan for several weeks, but when we first made it out, it was helpful to me. And so to look at it again, yeah, I'm certainly game for that.
Okay.
I appreciate your showing me that that's something you're wanting to check in with me about.
Yeah, absolutely, absolutely. So, yeah, let's take some time, if it's okay with you,
Sure.
at the start of our session, just to look at that safety plan, and then we can progress to our session. Thank you.
You're welcome. Thank you. Thank you.
Great job. Great job. This was a great example of how the conversation doesn't always go, as smoothly as we want or expect, and that we do have to really work on answering some, more difficult questions around the program and what it is and how veterans are selected. I think you did a great job of just creating a really open invitation for him to express his concerns and ask those questions and providing more explanations when things were still not clear. The point of this is to find sort of your own language around how you talk about REACHVET and explain things to your patients, but ultimately really trying to emphasize that it's a way to augment current care. I think, as Bridget pointed out, to really just thinking about how we can describe it to patients as sort of an alert system really for providers. This sort of alerts me that because of your medical history and certain factors in your medical chart, you may be at greater risk for these outcomes. And part of my job then is to make sure that you're getting the best care possible. And I know we're already doing some really great things. Are there other things? And I think you finally got to that point with him where he was really open to considering enhancements, specifically updating the safety plan and answering all of his questions. Wonderful job.
May I say something?
Yeah, please.
Because you were talking to me, I got the idea that when you got done answering all of my questions, I fell into this place of feeling that you care for me.
Good. I'm glad to hear that that's the way how you received it. So wonderful. That was the intention. So,
Thanks, Joe.
Good.
Thanks, Joe.
That's lovely. So really nice job with that, and Nazi, thanks for the thoughts on it as well. So that wraps up the 3 different scenes we wanted to play out for you all, and hopefully that just helps make this a little bit more real. So I just want to recap a little bit about kind of what you want to make sure that you're highlighting in each of these interactions, but really, as you can see across these examples, the way in which you do that is up to you. It's up to you, your clinical judgment based on what you know or don't know about the veteran who you're talking to, and so really bring yourself to that interaction, and you just want to make sure that you do introduce the REACHVET program. It's something that people are hearing about, veterans might be asking questions about, so we want to be transparent about this. This is what they've been identified through. And so talk about what that is, that they're at risk for suicide, hospitalizations, those kinds of things. And so what we want to do is check in to see that they have everything that they need. So oftentimes that'll include a brief kind of screen about suicide risk, and then really focusing on what we can do to enhance care, whether it's safety planning or additional groups, them coming in more frequently, whatever you think as a provider is indicated. And then also really hearing from the veteran what they need too, making sure that they have access to everything that they need, and helping problem solve around that if not.
Part of what the provider expectations are is to reevaluate the chart prior to outreach. And that's really important. It's really important to be transparent with your patients about that. So I know there's sometimes some hesitation or some awkwardness around saying that, but I think it's really important, an important part of the program, and really it conveys a sense of care.
Yeah. And I would say that certainly what Chad shared in terms of his impression of this interaction at the end and feeling cared for is what we've been hearing from the field too. Despite these conversations sometimes being a little awkward because it's a new thing to talk about, veterans are feeling very cared for and appreciate the extra attention. So we really appreciate your attention and kind of listening to all of this, and hope it's been helpful, and thank you for the work that you do.
This video and other educational resources that will help with this program are on the website, so please check that out. We're always striving to sort of help facilitate implementation by creating tools like this. So your feedback is really welcome, and please check out the website.
Thanks.